My topic this week is trying to think about um, how to further develop opportunities for the transdermal application of herbs. And For the most part, I'm going to be focusing on um, herbs for inflammation. So, I'm a physical therapist, have been for 30 years now. And one of the modalities that we have and have used for as long as, I guess, since I got out of PT school was iontophoresis. And these are pictures of some iontophoresis patches. What this treatment is it's less invasive than a cortisone injection. We typically use still a corticosteroid, dexamethasone is most frequently used. We also use sometimes in combination with an anesthetic medication, lidocaine. Um, so this kind of a treatment would be when there is a localized area of inflammation, maybe a shoulder or a hip bursitis, a lateral epicondylitis or a tennis elbow. Those are kind of real common. Sometimes plantar fasciitis. Um, those sorts of localized, um, often more superficial inflammatory states. So we put that medication in some kind of a patch like you see, and um, there's a battery operated current either coming externally from a little device, or these particular electrodes somehow have that built in internally into the electrode, and the depending on the polarity of the medication used, one of the electrodes is the positive, one is the negative. So you drive the medication through the skin that way. Um, so how I got from there to there. Um, I'm going to jump now to I guess it was last winter when I was doing my scientific writing class. I decided to look into um, ginger as an anti-inflammatory, trying to seek out, what herbs as a physical therapist, training to be an herbalist, I might be able to use in my practice. What I found was a really amazing woman by the name of Tessa Thurkelson, a holistic nurse living in New Zealand, who has done some extensive research on the topical application of ginger, particularly particularly in osteoarthritis. Um, Thurkelson is, as I said, a holistic anthroposophic nurse, and in her research, she details the history of the utilization of topical ginger in Europe as an adjunct treatment for muscle and joint pain. Um, and I actually reached out to her and had some conversation, some really great conversation going. She and her husband, um, flip the screen here, one more article there by her. She and her husband uh, created this standardized ginger patch, and they have done some studies again with osteoarthritis. And um, in their case, a little different than a physical therapy approach, where, for example, if you had a painful knee joint, um, my interpretation of their research, I mean, maybe this is more this anthroposophic nursing sort of philosophy. They would consistently put the patch um, in the low back region and based it on a more of a systemic effect of the ginger. I should be moving on to the next slide. I ended up purchasing some of these patches. They went for $2 a patch, and I tried to demonstrate what they look like. You can see it's really wet. Really smells like ginger. Um, my husband has a fair amount of back pain. I consistently, like daily for maybe a week, during when I was writing the paper, I put the patch on him. Last night while I was working on this, I put the patch on myself. I just put it on my low back. And it's just amazing, just you feel like there's a hot pack on you. It's really kind of amazing. When I was reading about their patch, I was assuming it was more of a, kind of a sticky gel-like patch, but it really is like kind of reminds me of those um, like the little wipes that you tear open. And let's see, let me stay focused here. Oh yes, so this idea, I had also previously been exposed to a Japanese acupuncturist who had was very big into ginger compresses. So, just making a really strong decoction and, soaking some sort of a cloth and applying it to my husband's back, which worked really well, but it was just kind of a pain. It was just kind of messy. Then the idea was you put it back into the freezer, not a big deal, but just something that, definitely typically almost required two people. Um, you know, I use my mother as an example. If it's not, even though she's got a lot of arthritis and a lot of pain, she doesn't like to sit down and, take any time. So, it would never be anything that I could get her to do on her own. So anyway, so I got into these patches. Um, I just want to go ahead and add at this point that so when I got ready to talk about this product this week, I was looking Tessa up again just to kind of review things, see if she had anything new out there. And I discovered that she passed away this past August. So I had to look back and see when did I communicate with her? And yeah, she developed bowel cancer that when it was found, um, I think her husband, who I ended up communicating with yesterday, um, I think there was like a 4 month time period when they discovered the cancer and she passed. And so maybe back to this company, their company. Um, he, he just he wrote the nicest response back that um, he wants to carry on her research with the topical ginger, and he actually said, we'd be interested in finding anybody who would like to live and be in New Zealand and take up this project. So anyway, it was really touching. I was really just kind of shocked um, by the whole thing. So moving on, I just wanted to highlight a couple other um, kind of along the same line, uh, things that I have run into. I sort of my guilty pleasure is following green skincare folks. And this is a woman, Haut Cosmetics, Haute Cosmetics, in Canada. And I've used some of her skincare in the past. And recently she's been discussing these patches, these herbal patches, she calls them wellness patches, that she is making. And so this one in particular, Shimmering Energy, Joy, and Anti-Aging, here are the ingredients that she's putting in it, which I just find really interesting. I don't know how she's doing it. I did reach out to her, didn't really get a whole lot back, but I'm really fascinated by this idea. I think she has people wearing them for like 12 hours, and again just discusses the benefits of avoiding the gut with some of these. Here's one: cleanse, rejuvenate, and rehydrate. Artichoke milk thistle and organic sulfur. Some of the combinations, I don't understand the reasoning. There's the ingredients in that one. So anyway, I would love to investigate the possibility of coming up with something that clients could apply themselves. I guess in my case, again, I'm looking for anti-inflammatory action, but I just think there is potential for a world of, I mean, we know that poultices and compresses and all those things we learn about, but what might be possible in the ways of product development to make them easy and more standardized, and therefore maybe a potential for research. So if anybody's interested in the ginger, please contact me and I will forward your info on to Mr. Thurkelson. Thanks.